I am Dr. Andrew Doan, a board-certified ophthalmologist. Have you wondered where cataracts form? What symptoms are associated with cataracts? Are cataracts treatable? In this video, I will answer these questions and also provide you 3 facts you should know about cataracts.
Let's get started.
Cataracts are the #1 cause of blindness worldwide, according to the CDC and the World Health Organization. In the United States, there are over 24 million people with cataracts. There's a shortage of eye surgeons around the world, and an untreated cataract will eventually lead to blindness. The good news is that the vision loss is reversible when cataract surgery is successful. In the United States and in countries with access to eye surgeons, it is rare to see severe vision impairment associated with cataracts.
Hey, listen, this is serious.
Decades ago, I was on a cataract humanitarian mission, and there was a man who walked over 120 miles, and so he couldn't see because the cataract was so bad. He could only have light perception vision. So when we're checking vision in an individual, and they can only see light, meaning that they cannot see even the hands move in front of them, or count fingers, or even the big letter E on the chart. The only thing they can see is when you stick a flashlight near their eye and you turn it on and off, and they can see the on-off of the light. So that's light perception. That's how bad his eyes were. So he asked his friend to escort him 120 miles to get his surgery. I performed the surgery, and on the next day, I find them next to this truck, and both of them were just laughing and talking and chatting. So I went up to say hi and to see how they're doing. And the man looked at me and said, "I am so happy. I can see the letters and read the words on this truck. I can see everything so clearly. I can see your face clearly." He was extremely happy. So that is how bad a cataract can get, to the point where a person can become blind and literally can become unable to take care of themselves. And surgery can reverse it within a day. If you're enjoying this video, please hit the like button. So fact #1, a cataract is the clouding of the lens of the eye. To understand how cataracts affect vision, let's look at this model of the eye. So light travels through the cornea, through the pupil, through the lens, which the light is then focused to the back of the retina, where the brain is able to perceive what is being seen. Anything that obstructs the light path from the cornea all the way to the retina will result in vision loss. So the clouding of the lens is a major issue. So the lens plays a major role in focusing light onto the back of the eye, onto the retina. So as we are born, our lens is clear. But as we age, it also becomes cloudy. So the #1 cause of cataracts is just getting older.
Getting old sucks. Don't let anybody tell you any different.
Other causes of cataract include smoking, diabetes, inflammatory diseases of the eye, trauma, UV radiation from the sun, and also congenital cataracts can also occur in babies, which require urgent surgical intervention.
Pretty overwhelming.
Fact #2. Symptoms can be gradual and can be observed in Monet's paintings. The visual symptoms associated with cataracts can be blurred vision, glare with lights, halos, faded or dull colors, double images when closing one eye, difficulty reading and doing near work, and difficulty seeing at night, as well as seeing ghost images. These symptoms are associated with the lens being cloudy and having opaque imperfections. I have had patients who had cataracts and they were convinced their TVs were broken because their TVs weren't as high definition as promised, but when they had cataract surgery, they come back and they are just amazed by the colors and the high definition of their TVs. I've had other patients who were convinced their couches were getting dirty and they were all brown. And after cataract surgery, they come back and they said, "Wow, I can't believe my couch was so clean and vibrant blue." So we can observe the changes in cataracts over time by looking at Monet's paintings of the water lilies and his paintings of the Japanese bridge. So early on, you can see that both the water lilies and the Japanese bridge were vibrant colors of spring and lots of detail. As he developed cataracts, the images or the paintings became less vibrant and less detailed. And in the late stages of his cataracts, it's just a big brown mess. So these paintings actually represent the visual evolution of somebody who suffers from cataracts and what it looks like from early to middle to late progression of their cataracts. Fact number 3, cataracts can be preventable and treatable with surgery. Cataracts are preventable. You can do these things to prevent or slow down the progression of cataracts. Protect your eyes with sunglasses from UV radiation. Quit smoking. Maintain a healthy diet. Manage chronic diseases like diabetes and hypertension. Limit alcohol consumption. Wear eye protection to reduce the risk of traumatic cataracts. Limit steroid medications. Cataracts that disrupt daily living and become visually significant can be treated with surgery. With cataract surgery, the cataract is removed and an implantable lens is inserted into the eye. The lens is typically made of plastic, silicone, or acrylic. You should discuss with your ophthalmologist the options that are available to you. In summary, a cataract is a clouding of the lens, and this clouding of the lens disrupts light to the retina and therefore will decrease vision. Cataracts can be preventable, and they can also be treatable with surgery. I am interested to hear your comments and questions about cataracts and about this video. Please place them below in the comments section.
Okay, I appreciate you doing this.
Also, please remember to like, subscribe, and turn on notifications for additional health tips. Until next time, I wish you health and joy.